To manage a mild to moderate allergic reaction, check for the following symptoms: swelling of the lips, face or eyes, hives or welts, a tingling mouth, abdominal pain or vomit. If you observe any of these symptoms, take action for an insect allergy. Flick out the stinger if it's visible. However, do not remove any ticks. Stay with the person, call for help, and locate an adrenaline auto-injector or a child adrenaline auto-injector if aged between 1 and 5. When you have located the auto-injector, phone family or the emergency contact. Mild to moderate allergic reactions may or may not precede anaphylaxis. Watch the person closely for any one of the signs of anaphylaxis. To manage anaphylaxis, check for the following symptoms: difficult or noisy breathing, swelling of the tongue, swelling or tightness in the throat, difficulty talking or a hoarse voice, a wheeze or persistent cough, persistent dizziness or collapse, and if it's a young child, they may be pale and floppy. If you observe any one of these symptoms, take action immediately. Lay the person flat and don't allow them to stand or walk. If it is difficult to breathe, allow them to sit. Give an adrenaline auto-injector or a child adrenaline auto-injector if aged between 1 and 5. Then phone an ambulance on 000 or 112 from a mobile. Call family or the emergency contact, and if there is no response after 5 minutes and there is another adrenaline auto-injector available, give a further dose. If you are in doubt, give an adrenaline auto-injector. If after giving the adrenaline auto-injector there are no signs of life, commence CPR. Or if you have given the adrenaline auto-injector but are unsure if it is asthma or anaphylaxis, administer asthma medication. To operate the EpiPen adrenaline auto-injector, form a fist around it and pull off the blue safety release. Place the orange end against the outer mid-thigh, with or without clothing. Push down hard until a click is heard or felt, and hold in place for 10 seconds. Then remove the EpiPen and massage the injection site for 10 seconds. The EpiPen is generally prescribed for adults and children over 5 years, and the EpiPen Junior is generally prescribed for children aged 1 to 5 years. To operate the Anapen adrenaline auto-injector, pull off the black needle shield. Then pull off the grey safety cap from the red button. Place the needle firmly against the outer mid-thigh at a 90-degree angle, with or without clothing. Press the button so it clicks and hold for 10 seconds. Then remove the Anapen without touching the needle and massage the injection site for 10 seconds. The Anapen 300 is generally prescribed for adults and children over 5 years, and the Anapen 150 is generally prescribed for children aged 1 to 5 years.